I don't understand why the Food and Drug Administration allows for these to even be in the food. A lot of them are neurotoxins. It's toxic to the nervous system, and some of them are known as excitotoxins. So when you feed your kids these foods, you are literally killing pieces of your child. All right, everybody, welcome to another episode of the Jacque Show. Today, we're going to be talking about another controversial topic. So we've got kids now, and we hear these diagnoses thrown at our children all the time, especially our sons. And the topic today is going to be on ADHD. Now, I remember way back when I was a young pup, I had this excess energy. And I didn't know what to do with it. Didn't know how to harness it. My mom was like, I'm not putting you on medications. I'm like, I've got ADHD, do it. Like, medicate me. And my mom was like, I'm not turning you into a zombie. It's not worth it. And I'm like, well, what am I going to do? So you figure out how to harness it. You figure out how to play sports. You figure out how to breathe properly. And then also learn about the diet. So today, what we're going to do is we're going to talk about not just the obvious diagnosis coming from the DSM-4, the DSM-5 now. We're going to be talking about diagnosis and then what do we do? What's the research showing? How do we work with this? If we're a parent with a kid who is not listening, who's not behaving, and we're struggling, we're embarrassed of the kid in school, and you're like, I don't know what to do. Like, this is just crazy, right? We're going to talk about that. Now, I remember back in chiropractic school, we studied from the DSM-4. So it's an outdated, but it's basically how do you diagnose ADHD? And one of the professors was basically saying, this used to be a disorder that was going to be categorized before a child had a chance to hit school. So if you look at the old DSM-4 criteria, and I don't know about the 5 now, but it seems like it's just, all over the place. But you have to be diagnosed with ADHD prior to the age of 7. So figure before, 6, 7 years old or so, kids are typically getting into kindergarten. They're typically trying to learn. And that's when kids are starting to squirm. Now, I saw an amazing post. There's a guy who made a comment about this on Instagram. And the guy's brilliant. I remember what his name is, but he's always got a lot of brilliant things to say. And basically, it's like, well, what do we expect? Right? As human beings, as Americans, what do we expect from our children? What are our expectations? And what were our expectations that our parents had of us and their parents had of them, and so on and so forth? What were they? What are they? Now, we're innate creatures. Our beings, our children, they are curious learners. They're always wanting to run around, grab something, feel something, smell something, taste something. Whether it's a rock outside they want to try to chew on for the first time, or like my son the other day, we're trying to go scorpion hunting out in the backyard. It's an experience. Children's goal in life is to experience life, to create experiences that are going to help them in the future. What we're doing now, because we're busy as Americans, we have husbands and wives working now. So kids aren't typically staying at home. We're putting them into a daycare setting, right? Or we're putting them into, like we put our kids in Montessori school, mainly for the education aspect of it. And then also to be able to socialize the kids with other kids, get germs and stuff to build their immune systems. But the Montessori system is great at teaching kids how to handle, if you will, the excess energy, and then how to really turn out to be brilliant. Now, again, with the diagnosis back in the day, being before you were the age 7, nowadays, we've got this adult onset ADHD, and they're like, well, it's genetic, it's this, it's that. No, it's not. What's important to note is that the majority of genes, okay, I won't say all of them, but the majority of genes can be shut off. They've done plenty of research studies on this, where if you do have a gene that's expressing itself, your diet and lifestyle is going to influence that gene to either be coded to be on, or it's going to shut it down. Our diet and lifestyle are going to handle that. So what is our diet like, right? And you'll see, we'll go through the research here, but if the diet is terrible and the lifestyle is horribly sedentary and your kids just eating processed sugar all the time, and they don't have any way to run off that energy because you're lazy yourself and you don't want to get up off the couch to go for a walk, go for a run, or go to take them to the playground. And then you're quick to diagnose your kid, hey, doc, my kid is exhibiting signs of ADHD, so I would like to put him or her on a medication. Now, the rate of ADHD in boys is higher than it is in girls. But again, we were innately in primitive history, we were the people who would be running around trying to gather rocks, sticks, etc., trying to hunt for food. Women were more domesticated. They would stay calm. They would stay copacetic. They would handle the household. They make sure everything was in order. So that way, when the men would come back, they would have whatever they cooked, skinned up meat was there. They would cook it up and everybody would sit down and they would have a meal. But kids would have to have tons of energy to be able to keep up with their dads. That's how our evolution has been, or what it was. And now we don't have that. We have sedentary dads. We have sedentary moms. They're not exercising. On the weekends, they're just sitting on their butts watching football all weekend. And the kids are just going crazy. And they're like, I don't want to deal with my kids right now, so I want to medicate them. Right? And it's just one of the worst things you can do. And back when I was a kid, Adderall and Ritalin were basically the only things, but basically it was Ritalin that was the main one. And we would know who was on Ritalin because they would be yay tall. They would stop growing. It would damage their growth plates, and they wouldn't be able to grow any further than the height basically they were when they got put on the Ritalin. So for a very young age, I'm like, ooh, man, for those of you who don't know me, I'm 6'2". So I would have stopped at a very, very young age. I would have been growing, and probably my wife wouldn't have chose me because I would have been a little guy. No, she probably would have. But the point is, this is what it used to be back in the day, and this is what it is now. So I'm going to pull up some research that I was gathering here for this particular podcast because I want to bring forth not just my opinion on this, but the research that's coming out here. And the cool thing is, like, when patients bring their kids to me, I don't really have to work that hard. It's pretty easy. You're going to get the same test that the majority of my patients are going to get. But we see certain patterns in our testing that are going to reflect these behavioral patterns. All right. So again, old school diagnosis of DSM-4, DSM-5 is you'd have to be diagnosed with ADHD before the age of 7. Right. And then where does this all come in? So again, with parents who have children, we have a lot more distractions. We're trying to look for my phone. Here's a phone, but here's a phone right here. So kids are on tablets. They're on iPhones, they're on computers, they're on all of this excess blue light technology that's just stimulating cortisol in their freaking faces, right? Because what happens when you take a tablet away from a kid? They go crazy, right? They're neurochemically basically addicted. Their brain transfers, their dopamine, everything is highly related or highly correlated to that tablet because they're not getting it elsewhere, because they're not being adventurous. They're told to settle down, don't do anything, stop. That's just the general gist, if you will, of parenting nowadays. So then again, tablet. Johnny goes to school, sits down. They no longer have that experience. So it takes more for them to get that dopamine hit. So they're going to act out more. They're going to be running from thing to thing to thing to thing to thing, right? If you want to see a kid have ADHD really quickly, do a weekend marathon, binge watch movies, or have them binge on a tablet and watch their behavior, not just while they're in it, but afterwards. Their attention span is going to be cut down. They're going to be all over the place. They're going to be fidgety. They're going to have so many more exacerbations of ADHD type symptoms. So the reason I'm saying this isn't just necessarily to call those people bad parents. It's to call in awareness to say, oh, so if I stop having my child use these devices, then I can calm my child down? The answer is an overwhelming yes, right? It truly is. The other thing that you'll see, right, is when kids are on tablets or they're watching TV, they're going to crave carbs, right? Because the blue light is going to stimulate cortisol in the body. Cortisol is going to release sugar or glucose out into the bloodstream, so their insulin is going to go up. So they're going to have insulin dysregulation. Then they're going to crave more sugar to balance their blood sugar out. Therefore, the problem continues to perpetuate. We're also, 2 weeks away or so, a week or so away from Halloween. What's going to happen on Halloween? You're going to have a bunch of shitheads running around, and you're going to want to beat your kid senseless when you should be beating yourself senseless, and not in an inappropriate manner, but you want to beat yourself senseless because it's your fault that your child is acting that way, because you chose not to stick up for that child. You chose to feed them crappy food. And you're going to have a crappy kid because what you put in is what you're going to get out. And we're going to talk about the excitotoxins and the artificial colorings and how that can stimulate an ADHD type response. So even if your child doesn't have clinical ADHD, if you feed them the standard American diet and you feed them the sugar, you will have a kid this Halloween or this season, right? It's the cold season, flu season, because everyone's immune systems are crushed from Halloween candy, which will be another podcast I'm going to do too. So parents beware. But again, going into this, we need to look at the underlying cause. And a lot more research has been coming out. And I'm so happy it has been, because it's been seen as like a neurological thing. And so people are like, oh, let's treat the brain. But in fact, it's not the neurological, it's the gut. It's what's happening in the gut. It's what bacteria is either too high or too low, or what infections are now found in the digestive tract, right? Because if our digestion's off, we're going to have more food sensitivities or more food allergy type reactions, right? We're not going to be able to digest food properly. We're going to have mineral shortages, right? We're going to have nutrient malabsorption. So our kids are going to basically be starving themselves because they're not getting everything from their food that they should be, right? And then they're having all these infections that also happen. So how does that happen? Well, the standard American delivery is what is going to trigger this stuff. So I am a huge proponent of giving birth. Give birth any way that you see fit. But what is the healthiest gold standard is going to be, in my opinion, it's going to be a home birth, no drugs, no stitching, no nothing, no goo in the eyes, no vaccinations as soon as you get that stupid freaking doctors taking the baby away and jabbing your baby. If you want to have the healthiest baby possible, vaginal delivery, keep the bacteria and all the goo that's on the baby for as long as you can. Keep the umbilical cord attached. Do not clamp it. Allow it to keep going through, feed in all the nutrients and stuff to the baby. And then eventually you can clamp and cut the umbilical cord. But you want to keep your baby in that baby goo for as long as possible, because that's your ecosystem. That's your microbiome coating the baby. And so then you do skin-to-skin contact. Skin-to-skin contact is then going to allow for mom and dad's bacteria that's on their skin, because we're made of bacteria, to then transfer onto the baby, give the baby a little bit of also defense or exposure to more harmless bacteria to test their immune system so that it gets nice and strong. What happens next, right? So standard delivery nowadays is C-section. Everyone's getting C-sections. I just had conversation with a lady on how they forced C-sections in. It was absolutely disgusting. Like disgusting. They forced her. Like, I don't want to. And they're still like, oh, we're going to do it. Right. And it was somebody near and dear to me. I didn't know her birth story, but she basically had to fight a nurse to basically say, get out of here. And she had a C-section before due to that nurse saying that she wasn't capable of doing it. And then she found out that nurse, all she wants to do is schedule people for C-sections because it was more convenient for her. So she did a VBAC, vaginal birth after cesarean, which a lot of women don't even know that that's out there, because their doctor's like, well, once you have a C-section, you'll always have a C-section for any baby that you deliver, right? Which isn't healthy for the child. You're skipping the whole bacterial level, cutting the umbilical cord quickly. It's an emergency procedure, so baby's getting rushed off quicker. So they're spending less time with you. They're on a sterile table. They're scared out of their dang minds, and they're just a cortisol-driven baby now. Step 2, what's super important for your kids? Breastfeeding. Despite what the elites would say, or the powers that be would say, breastfeeding is one of the best things that you can do for your child. Absolutely, hands down, bar none, best thing you can do. And new moms, be patient with this. It could take up to 6 weeks for your milk to let down. It could take time. Don't stop having the baby latch though. All right. Also check that they have tongue tie or lip tie, because that would be another thing that would make it difficult for baby to latch. But in that latching, you're going to be continuing to pass on your immune system to your child, your ecosystem, your microbiome. Everything is being passed to that child. Not only that, but breast milk is so amazing that when the saliva from the baby touches the nipple, the mom will actually produce the antibodies for whatever it is the baby's going through and pass that through the milk so baby can beat whatever it is that they're going through. Pretty freaking amazing. The alternative of that is what they're trying to do is push moms to get back to work so that they can feed their babies formula. And formula is one of the worst things that you can do for babies. And I know this is controversial, and I know that there's a formula shortage. And I know that there is a time and a place where if moms like legitimately cannot produce milk, I get it. And you have to rely on formula. But there are things in there, there are recipes that you can do that are going to mimic your formula better than the shit that you're going to buy on the shelves. But for the moms out there who are just like, I just want to have a kid and I just want to feed a formula, you're a bag of trash. You're a bag of trash. Because you shouldn't have had a baby to begin with. If you're not willing to do the duties associated with being a mom, you shouldn't have had a kid. You should have thought it through, right? Or put that kid up for foster care because you're a bad mom. It's going to continue to happen. And yes, I am mom shaming right now. Breastfeed is the absolute gold standard. If you're like, I cannot produce an ounce, I've tried everything, I've been adjusted, I've worked on my diet, I've worked on my nutrition, I've worked on this, I've worked on that, they just won't produce any milk. Okay, make your own formula and stockpile it. Stockpile your own formula. Or you can go, there's breast milk like donations where you can actually get breast milk from women who had a surplus. You can use that, right? There's plenty of other options. And I'm stressing this because of what we're going to be going into. When we use formulas and we early feed our babies a bunch of dairy because pediatricians say you need milk to make the strong bones, which is a load of crap. What's going to happen? Your kids are going to start having ear infections. More ear infections your child has, the more antibiotics that your child is going to go under. One round of antibiotics is going to alter the ecosystem or the microbiome of the gut, but it's also going to open up those tight gap junctions and lead to gut permeability or leaky gut. Therefore, more food sensitivities, more food allergies are going to take place. Also, inflammation is going to pop out through the bloodstream, and then that's going to cause a fussy baby, an angry baby, more earaches, more screaming, more belly pain, not being able to lay them down, just an anger fest just all around. So we want to stay away from that. We want to stay away from that. Trust me, you want to stay away from that. And if you're like, oh, I don't believe you. Our kids have never had an antibiotic in their life. They were breastfed till they were at least 1 year old. We waited a while till we introduced food, and even past when they started getting their teeth in, at least 8 months to introduce any type of food at all. We did a slow introduction of that stuff, right? Because we know that that's what you're supposed to do. I've read the literature, I've read the research, I've found how long it takes for a child's digestive tract to be fully formed. Because if you add in foods too quickly, you're going to develop sensitivities, which is exact opposite of what doctors will tell you. You need to introduce these foods so you don't have food reactions. It's a lie. If the gut is not complete, those foods are going to slip out in the bloodstream. You're going to have more risk for food sensitivities. Trust me. Okay. So, or do the research. Doesn't matter to me. Okay. So we've got damaged guts, damaged babies, babies on antibiotics, not being born healthy. And then again, hustle and bustle. Kids aren't being seen. Okay, they're not having attention. And I'm not saying that you need to spend every waking minute paying attention to your child. But for parents who are just on this the whole time, that was an iPhone for those of you listening, on iPhones or phones the whole time, or computers the whole time, or working the whole time, and your child is not getting attention. Tony Robbins talks about this. It's the level of significance, right? And people do this in relationships too. Significance comes from attention being paid, more or less, especially for kids. So if a child's not paying attention and they try to be super cute and like, hi, daddy, I love you. You're like, oh, I love you too. End of conversation. And they're like, well, okay. And then they'll walk. Versus if they come up to you and they start yelling, screaming, take your phone, throw your phone, yell, I want snack, I want this, I want that, I want this, I want that, I want this, I want that. You're like, what the hell is wrong with you, kid? You're spending more time with them, even though you're yelling at them or getting frustrated with them. They're getting more time where you're paying attention to them. Children are smart. So then they learn that if I want mommy or daddy's attention or the teacher's attention, I'm then going to act out in order to get my needs fulfilled. Because if I'm nice, nobody pays attention to me. If I'm mean, everybody pays attention to me. So know that as well. If you're in this loop, you're like, I don't know why my child is acting this way. Try doing a social media detox. Get off your freaking phone. And because the other thing is you're painting a picture saying that this phone, or this computer is more important than your child, which is ridiculous to even think of, especially if you're just scrolling on social media, right? Because you're consuming garbage on social media, unless you're watching my stuff and listening to my stuff. And it's great. It's very well done. But honestly, get in, get out. And don't do it in front of your kids. Because if you're rather, again, watching TV or whatever, and you're not paying attention to your kids, what kind of picture is that painting for your kids? There's going to be neglect associated with that. Okay. And then they're going to have attention-seeking behavior, which is bad behavior. It all makes sense when you paint the picture. So now what's some of the research saying here? So I have some studies here that they pulled up. So I'm going to read this one as a conclusion. And so infant gut microbiota is associated with ADHD development in pre-adolescence. So basically what they're saying is the importance of the infant's digestive tract, the infant's gut. If it is damaged, if it is inflamed, if they receive too many antibiotics or too many vaccines and alter the gut flora, then as adolescents, okay, they're more likely to express ADHD. So it's not just in the moment thing. It's you were damaged back then, and really parents don't really learn all that often unless somebody tells them, like I am. Then what happens in years and years and years and years and years of accumulation of inflammation, toxic lifestyle, and then all of a sudden the kid's going to express ADHD as an adolescent. So know that. This is why, again, breastfeed, vaginal birth, make sure you're not getting dairy in, make sure you're making healthy food choices for your child. Parents, this means you also need to make healthy food choices. Otherwise, you're going to be teaching your child to eat garbage. And then you're going to get mad at your kid for eating garbage, acting like a jerk. And you're like, wow, what's wrong with you, kid? You're feeding them poison. So maybe take an education class or something on that so you know how to properly feed your child. And I know, again, it's going to be inflammatory. Moms, dads are going to be pissed off at me. I don't really care because I'm tired of crappy kids. I really am. And I'm not tired of the kids being crappy. I'm tired of how parents are raising kids nowadays. It disgusts me. It really does. Especially when I work so heavily in infertility and I help women get pregnant. And you see these jackwagons who have no business being a parent at all, and yet they have children. And you're like, oh my God, you don't know how lucky you are. You have no idea. Parents have no idea. So anyways, moving on from that one. So again, you want to make sure that you take a look into that. So in terms of bacteria here as well, there is a new bacteria in research right now. It's called Faecalibacterium or Faecalibacterium prausnitzii. And what they're knowing about this particular bacterial strain is that it is known to be an anti-inflammatory strain. It increases butyrate activity, which again, it stops any type of inflammation. It helps raise butyrate levels. So that way your body is in an anti-inflammatory state. It stops these cytokine storms. So what they're finding is a lot of children with ADHD have very low levels of Faecalibacterium prausnitzii, and they're expressing ADHD. Another weird thing about this, right, is that this particular bacteria is being found to be lowered or eliminated below detectable limits post-COVID infection. Pretty interesting, right? I wonder if they did that on purpose. More than likely, right? So when we have low Faecalibacterium prausnitzii, the child's body is going to be more inflamed. So what are we going to do with this? We're going to try to naturally treat this, right? Holistically, whole food, treat this. You can take supplements, sure, but I would rather you teach your children how to eat properly, right? So first off, when we're trying to eat properly, what are we going to avoid? My main tops that I talk about all the time: dairy, gluten, corn, soy, processed sugars, and then, especially for this, your artificial coloring, your excitotoxins. Eliminate those, and then what do we add in? We have to add in fiber. Fiber allows for these to grow. Now, fiber is not an old person's stool softener. It's not Metamucil. This is actual fiber. Fiber is foods that are going to benefit your gut bacteria. Fiber is known as a prebiotic, which means it is like a fertilizer for already established microbiome or already established good bacteria. So these ones in particular that you want to focus on, there's two different types of strains. There's an inulin type, which you've seen a lot, or you may have seen a lot with. And then there's another one called arabinooxalans, which I'm going to say don't use these ones. The inulin types are like chicory root. You can see it in fruits, vegetables, onions, bananas, leeks. These are the ones that you want to try to focus on. So again, chicory root, fruits and vegetables, go figure, onion, banana, and garlic and leeks. All right, these are food sources that you can use And this will allow your child to naturally replenish the good bacteria. Pretty simple. Doc, my kids don't like vegetables. Well, here's a trick. Veggies on the plate first. You have that delicious protein and maybe a delicious sweet potato. And you're like, hey, eat your veggies. And then you'll gain access to those. That's what we do. If my kids are acting like jackwagons, right? And they're sitting down and they're like, I don't want to eat this. Or they just start eating their sweet potato first. I take their plates. Megan knows this. I'll take their plates, dump it off, give them back their vegetables and say, you eat that first. And then you can have the sides, right? Because we want to have the focus mainly be on the starchy vegetables and the protein. Those are the stars of the plate. And then you can have these other healthy carbohydrates, sweet potatoes, carrots and stuff. My kids love carrots. You can add those things in there and it will benefit them. Okay. Another one that's really delicious, that was a cool one that I found, is kiwi fruit. Kiwis actually increase the Faecalibacterium prausnitzii. So it's not like it's hard to do it. They're delicious foods. Fruits and vegetables are amazing. Kiwis are delicious, right? So eat these things. Eat these whole foods and your child can reduce their risk of ADHD or reduce their symptoms of ADHD because you're helping to supplement in a healthier diet. It's really simple. What else can you do? Okay. Other things that you can do. Our kids, we're blessed with our kids love fish, but getting in a good omega-3 supplement can help kids tremendously. Now, there are drops like omega-3 drops because most kids can't swallow pills. Put that just right directly in their mouth to give them some omega-3s. There are little soft gels that you can use that kids can get away with, but usually the drops are going to be the easiest to get it in. Now, if you have like a pre-puberty or prepubescent or an adolescent or a teenager or whatever, then you can have them do and swallow just normal omega-3s. Again, it's anti-inflammatory. It's going to help brain health. It's going to help the nervous system, help calm symptoms of ADHD. So another fun fact, another fun thing that you can do here. Okay. The other part of this, right, where this is kind of controversial again, especially in this study, it was even saying this, but this was a study that was done back in the 1970s by a guy named Dr. Benjamin Feingold. And he found that hyperactive children that were given a diet free of artificial food additives and dyes reduced symptoms of hyperactivity. So reduced their ADHD symptoms. So a diet free of artificial food additives and dyes. This is a hot topic for me because I don't understand why the Food and Drug Administration allows for these to even be in the food. A lot of them are neurotoxins. It's toxic to the nervous system, and some of them are known as excitotoxins, which means they go up through the brain and excite your cells so much that they die. They trigger cell death, right? So when you feed your kids these foods, you are literally killing pieces of your child. Let that sit in for a second. So you think that if the cells are exploding in their brain, that they may have behavioral issues? Hard yes. So what are some of these? So I made a list here. So we have the whole natural flavors debate. Right? Natural flavors have excitotoxins in them. One of the big ones is MSG. MSG, monosodium glutamate. It does the same thing, can open up the blood-brain barrier, which is like a netting, if you will, or a screen or blocker filter from your blood to the brain. These foods can open it up and allow for these excitotoxins to go into the brain and cause cell death. So natural flavorings, hydrolyzed vegetable protein, autolyzed protein, plant protein can sometimes do it, textured protein, yeast extract, nutritional yeast, carrageenan, and again, anything with like glutamate. Other things that can do this is going to be your aspartame. So if you're feeding your kid Diet Coke and it's got aspartame or one of these other soft drinks or whatever, they're like, oh, we're zero sugar, zero carb, and you have aspartame in it. There it is. There's your excitotoxin. Okay. It's also been seen not just with exciting the brain so much, but headaches, sleep disorders, epilepsy, seizures, and ADHD. Casein is another one. It's cheese, more or less. So when you have cheese, it's going to increase your glutamate overload and it's going to cause cell death in the brain. It's like, what? Eliminate the foods. At least do this first. Put some work in. Show your kid you care by eliminating this food, but you have to do it first as a parent. I don't care if you have symptoms of ADHD or not. You're going to have symptoms of other things, right? Medications. Common medications are going to be your Adderall, your Concerta, Dexedrine, Ritalin, and Vyvanse. some of the most common ones. Now, Ritalin, Vyvanse, and Adderall was floating around chiropractic school like it was nothing. It's basically legalized cocaine. They're amphetamines. And that's what you're giving your child to treat them for ADHD. I'm not going to tell you the side effects of them. I want you to go and if your kid is on one of these, do actual PubMed research. Type in Adderall NCBI side effects. Anything NCBI is going to bring you up PubMed medical research. And there's other ways that you can say, oh, is this a good study or not? But there's tons of stuff out there. And it basically shows you that this stuff will cause brain damage, especially for prolonged usage. Stunted growth, right? It damages the whole body. So make sure before you think about putting your kid on these medications, try these other things first, right? Because what should we do, really? And this is why it's so easy for me. If you have a child that was just born, what do you do? Okay, 2 strategies. Number 1, food sensitivity test mama bear. Why? Right? You could do it to the child if you want to. It's tough. Test the mom, because mom's going to give the antibodies that she has over to the child. So if mom has a sensitivity to avocado, baby's going to as well, right? What else do we do? Test for the child's microbiome. Get a stool sample in. Figure out what's on there, right? And our stool test that we use is going to test for that Faecalibacterium prosnitzi. They've also seen links with bifidobacterium in there too. You want to have a normal, healthy microbiome down there. You don't want to have over or under expression of anything. Baby's gut should be flawless when they come out, right? If they have inflammatory markers, well, your child is going to have developmental issues, going to have attention issues, going to have growth issues. They're not going to be able to hit their milestones. They're not going to speak properly. They're not going to walk properly. You're going to have all of these problems. Test your child. Run a stool test, okay? As a child gets older, stool test, and you can run an organic acids panel. So the organic acids are going to test to see if there's any organ systems that are failing. We'll be able to look at amino acids, right? Precursors for dopamine, those types of things. And we're also going to see detoxification markers. So if they're not detoxing inflammatory toxins as well, what's going to happen is you're going to just bog down the child's body. They're going to overexpress themselves with toxins, and they're not going to be feeling very well. They're not going to be acting very well either, okay? So we do these things, we test these things, and we do a basic remove. And you don't need any testing for this per se. Remove the food sensitivities and allergens that we previously mentioned. Eliminate those main triggers: gluten, corn, dairy, soy, processed sugars, colorings. Remove abusive stressors, so family, friends, abusive relationships that you are a part of and your child sees. You don't want your child mimicking those behaviors. And then if you're in a moldy home, get out of the moldy home, okay? Testing wise, as they get older, okay, we're starting to hit puberty, we throw in an adrenal panel on them, test their adrenals, because there is a strong neuroendocrine or an adrenal link to expression of ADHD. Right? Because if you're stressed out all the time, you're high strung, and then you're going to have more fidgety. You're going to have all the symptoms that are going to correlate to ADHD at a much older age than 7 years old. So parents out there, please, please, please start with the diet. Know this stuff, especially going into the Halloween season. Next podcast we're going to do is going to be on sugar and the effect on the brain, the immune system, and watch out for the next wave of coughs and colds, because everyone's going to eat sugar this year. Hopefully they're not eating fentanyl, because Biden has dropped the ball many times and there's candy colored fentanyl and stuff. But parents, be careful with all of this stuff. And I'm going to end on that. So if your child has ADHD, or if you're worried that your child has ADHD, try these things first before ever medicating them, and try to understand where they're coming from. That being said, I'm out. You guys have a blessed day.